Hi there, this is Dr. John Carrizella from the Florida Center for Hormones and Wellness in Orlando, Florida. And I'm making this video about thyroid because it seems to be one of the most common questions that I get in my office. As you all know, I do hormones and wellness, and I spend a lot of time dealing with the hormones of menopause and andropause, that is, women after they go through their hormonal change, and men as their testosterone goes low. But one of the most commonly associated hormone problems that we see with this is thyroid. In fact, in my opinion, thyroid is one of the most underdiagnosed and undertreated hormonal problems that we face. And beyond that, the understanding of why thyroid is treated and how it is treated to optimize the results is way misunderstood, in my opinion, in the general medical community. So I want to take about 5 minutes and go through thyroid, and this will be useful for anybody who's just trying to get some understanding of what I do in this office, and in particular for some of my patients who seem to continually have a lot of questions about thyroid management. So, in my opinion, thyroid is woefully mismanaged in this country. It's really kind of a shame, because I see people coming in that are clearly hypothyroid in the way that they act and the way that they feel. But why is this? I think it's because doctors today are just way too busy. And another thing that I just hear every single day, my doctor just doesn't listen to me, okay? What they're trying to do is they're trying to treat little black numbers on a white piece of paper instead of actually listening to their patients. Well, that's really not the way to take care of patients. We want to listen to the patients, make sense of their complaints, correlate that with the labs, and then go ahead and try to figure out what the problem is so we can put the solution into effect. Isn't that the point of doctoring? Making people feel good? So many doctors just do not understand the concept of hormone optimization. That is, what level of hormones does the patient actually feel good at and function optimally? Well, thyroid symptoms are wide and varied. According to the Mayo Clinic, there's a whole bunch of them here. You can read through them yourselves. But the typical ones that we see are dry skin, thinning hair, cold insensitivity, weakness, weight gain. Those are the big ones that I see every day in the office. And people will complain about these things, and it's very clear that they have hypothyroidism, yet their doctor says, nope, the lab test says that your thyroid is normal. Well, let's understand that a little bit better. And in order to do that, I got to teach you all a little bit about some basic science. When we look at thyroid, here's the thyroid gland over here. The thyroid makes a substance called T4, which is an inactive form of the thyroid hormone. And the T4 is converted with an enzyme called deiodinase and a number of other micronutrients, including zinc, magnesium, and selenium, to the active component of free T3. And it's that thyroid component, that's the active hormone, that affects the end organs in your body, virtually every organ system in your body. Well, when this T4 and T3 are created, they will then feed back to the pituitary. And the pituitary, trying to communicate to the thyroid, is making this substance called TSH, or thyroid stimulating hormone. So let's look at it this way. Here's our little circuit, okay? Here's T4, here's T3, here's TSH. Well, when the pituitary senses that thyroid hormones are low, it will make more TSH to stimulate the the thyroid, to say, hey, thyroid, you need to make more hormone, okay? So when we look at it in balance, when your thyroid hormones are adequate, that is, they're heavy, there's a lot of them, TSH is light or it's low. So if we have good levels of thyroid hormones, our TSH is low. Conversely, when our thyroid hormones are light, or there's not a lot of them, our TSH goes high. So this is what we call in medicine a feedback mechanism. So it's kind of like a teeter-totter, just as I have it illustrated here. It's an inverse relationship between the TSH and the active hormones that the thyroid produces. And interestingly, conventional medicine every day is looking at TSH. Why are they looking at TSH? It's an indirect measurement of thyroid function. In order to get to TSH, thyroid has to make the T4 and the T3. The T3 and the T4 have to indicate to the pituitary what the status is, and the pituitary then responds by either increasing the amount of TSH if it wants more thyroid in the body, or decreasing the amount of TSH if it thinks that there's enough thyroid in the body. Now that's the most important thing, because it thinks that there's enough thyroid in the body. Well, why do I emphasize that? Let's look at the next slide. There are so many factors that will influence the pituitary to thinking that there's enough thyroid in the body. So not only do you have the T4 and the T3 feeding back to the pituitary, you have all of these external environmental influences like the genetics in your body, drug toxicities, environmental toxicities, inflammation, infection, oxidative stress, autoimmune disease, and a whole host of other ones. These external environmental influences will impact the pituitary and make the pituitary think that there's enough thyroid hormone in the body, and it will react by lowering the TSH. It used to be that that balance was fairly well matched. And in the old days, we could measure the TSH and get a good indication of what was going on with thyroid hormone. But that doesn't work very well anymore, yet traditional medicine is stuck on maintaining this belief that TSH accurately reflects the active hormones in the body. So let's look at it. What does this mean? The TSH might be actually lower than one would expect from any given active hormone, that is the free T3. That's because the environmental influences make the thyroid think that there's enough thyroid hormone. So someone who just follows the TSH as the indicator for thyroid hormone function might believe that thyroid levels are actually adequate when they're not. And this is the circumstance I see all too often in my office. And yet we see most everyday doctors follow the TSH. Why do they do this? I don't know. I guess that's just because the way that it is. It's tradition. That's the way that establishment medicine says that you practice thyroid medicine. You measure the TSH and you treat according to the TSH. Another reason is way back in the day, TSH was very cheap in relationship to free T3. And so since back years ago, measuring TSH was a very good way to indicate what the thyroid hormones were really doing it. We measured the cheaper one and used that as a proxy or as a stand-in or as a substitute for thyroid function. Well, as we just saw in the previous slide, that doesn't work anymore. The next thing that we need to understand is this concept between normal and optimal. In many labs, the normal range of free T3 is somewhere between 2.4 and 4.3. And of course, this varies from lab to lab, the exact range. So let's take this spread of 1.9. Many times a patient will have a value of something like 2.7. And I got to tell you, well over 50% of the people that I see in my office are less than 3.0. So if we take 2.7 and look at it relative to that low end of the range, it's only 0.3 away from the bottom edge of the range. This is only 15% above the bottom end of the range. While this might be a normal value, it might not be the best value or the optimum value for any particular patient. In reality, what I see, in particular, many women prefer to be at the top end of that range. And when I see them at the low end of the range and I put them up at the top end of the range, sometimes even higher, they feel so much better and their thyroid symptoms seem to clear and go away. Well, why is this? Let's look at the difference between normal and optimum. Many of you may or may not understand statistics. You got 1,000 people in a room, and when you measure their thyroid values, if they're, quote, normal, they will fall somewhere in the middle. Okay? And what happens and what we define in medicine is we just do a very cold statistical determination. And we say that 2 standard deviations above and below this average number right here, we're going to call this normal. And we're going to say anything outside that range is low, abnormal. And anything above that range, we're going to call it high, abnormal. Well, normal is just a cold statistical statement. It doesn't say anything about quality or function. Let's take a look at that. This requires us to understand a concept called receptor sensitivity. Receptors are little key locks that exist on the surface of a cell. And that cell makes up a tissue, makes up an organ like the heart, or a tissue like the blood vessels, or another organ like the bones. Well, the hormone is like a key, and the key fits into this lock. Okay? More specifically, here's a hormone molecule, and here's what a receptor might look like on the cell surface. So that hormone will come along and it will try to plug in and it will activate that cell receptor, kind of like a key fitting into a lock, turning that lock and activating the lock. That hormone, when it fits into that cell receptor, causes that cell to make a function. Well, sometimes these receptors have problems. Just like we saw earlier, these influencing the pituitary, they can also act like sand in a bearing when it comes to a receptor. What does that mean? So here we have these environmental influences, these little irregularities now that fit in that key lock. You can imagine as this hormone tries to fit into that receptor, it just doesn't fit right. So what do? Maybe we go back and we try to repair or remove these influences. Well, sometimes we just can't do that. Sometimes something like a genetic problem, that's permanent. It can't be removed. And there are others that will be there that either can't be removed or the treatment to remove them will be far worse than the problem that they're causing. So what do? We just go ahead and we have to try to pry that receptor loose. We actually have to force it to work under the circumstances that exist. Well, how can we do that? Well, we can take this hormone and we can put it there, and what we can do is we can just try to pound that hormone into place. Well, how do we pound that hormone into place? What we can do is we can use brute force. That is, we can take that hormone, we can increase the amount of hormone that's in the circulation, and it will act like a hammer, pounding that receptor into submission. So what I'm trying to say here is that some people that have good, healthy receptors or receptors that are genetically more receptive to the hormone, they might need a small amount of hormone. Other people that have receptors that need more hormone just need more hormone. So that's why we can't look at a laboratory value that is a black number on a white piece of paper and say that this is where your hormones need to be in order for you to function right. We have to take into account that every single person that we see in this office is an individual, and that individual needs to be adjusted with their hormones to a degree that suits them properly. That is, when they come in saying, "Doctor, my hair is thin, I'm cold all of the time, my skin is dry," they're saying, "My hormones, my thyroid hormones are low," or "I don't feel like I have enough thyroid hormone in my body." And so what we either need to do is make that receptor respond to the hormones that are there, or just put in more hormone. So that brings us to a very interesting question. If we use more hormone, is it dangerous? That is, if it's more dangerous to raise that hormone level, we cannot use the brute force method. But here's the interesting thing. If we go into the medical literature and we find out that it is not dangerous to raise hormone limits, we can safely raise that limit in order to get the effect that we want. And in thyroid, we can safely raise those hormone levels to achieve an effect that we can in order to get thyroid function better. And I see it every single day. That is, when I raise people's thyroid hormones, they feel so much better. Their hair is thicker, their skin isn't as dry, they don't feel as cold, they do and function much better. Now, I'm not saying that I can raise them to extremely high levels on every single patient. People will sometimes have side effects from high levels of thyroid. That's why we have to pay attention and listen to the patient. When they come in and say, "Hey, doc, I'm feeling an occasional extra heartbeat," Maybe their heart is a little extra sensitive to the thyroid. Well, what do we do in that case? Well, it's very, very simple. We just lower that thyroid a little bit, and they feel better, and they do better. So when it comes to hormones, it's not just little black numbers on a white piece of paper. When it comes to hormones, it's extremely important to treat people very carefully and very specifically, to listen to their complaints, to listen to their response to how they do with the hormones, and then to treat them accordingly. So this is Dr. John from the Florida Center for Hormones and Wellness, and I thank you for listening to this, and I hope this explained thyroid function a little bit more, both to new people who might be looking at this office and considering it as a place to come, but more importantly to the people that are here that have questions about thyroid and why I treat thyroid the way that I do, and why I seem to be a little bit more aggressive when it comes to thyroid management to everyday doctors. Again, Dr. John from the Florida Center for Hormones and Wellness. I hope you all have a great day.